So I'm going to start with a couple of comments before the presentation. We've got a pretty varied geographic audience, Alaska, everywhere else. I'd like to just sign of hands in urgent care for 0 to 5, just starting an urgent care center. Let's start with that. Anybody? Just starting? Just starting? Good. 0 to 5 years? 5 to 10 years? 10 to 15 years? I'm catching you. I'm catching up. 15 to 20? Over 20. There we go. Well, you guys don't need to be here. You don't need to listen to me. My name is Mike Boyle. I am with ECI Healthcare Partners. We're a company that provides physician staffing for emergency departments, hospitalists, and urgent care centers. I come from the hospital-based world. I don't see you as competition at all. I see you as partners. Our facilities, we put the physician in, and the hospital provides the nursing staff and the urgent care center itself. I'd love to talk with you about the differences and where you fit in. Hopefully I will do that lecture next time. I am originally trained in emergency medicine in Virginia, from Virginia originally, went to Ohio for residency, went back to Richmond, Virginia for a couple of years, did emergency medicine, occupational medicine, a lot of fast-track programs. Then ventured out to Houston, Texas, where Texas, as I was talking to the gentleman from Laredo, has gone completely nuts. There are, I would say, at least 40 freestanding EDs on every corner. Keep in mind, they're going to go out of business. You guys are in the right spot. Left Texas, came back to Virginia, and now I manage facilities in the Northeast for ECI Healthcare Partners. I will tell you, I am very interested in healthcare reform, very interested in the right patient, the right place, the right provider, and the right place. And you guys, number one, you're sitting in the right place. Number two, you're in the right business at the right time. So this is an awesome opportunity. Lots of competition, but don't worry about it. You'll do fine. I don't know whether I really have to disclose this or not because I only get $5 per book, but I authored the Healthcare Executive's Guide to Urgent Care Centers and Freestanding EDs. It came out in 2012. It's ridiculously expensive, but if you're interested, it's in Health Leaders Media Publishing. Objectives. We want to talk about emotional labor today. That's the game face. That's how you and your staff present yourselves to your patients and everyone else. 5 traits of the A-team and how you foster the A-team behaviors. You need to be aware of, well, what the heck's going on with Dr. Boyle? He's acting like a twit today. Is he getting burned out? 3 methods for helping to improve your staff morale and performance, and we'll talk about the golden rules. We'll bring this back again. A wise gentleman that I was affiliated with for a couple of years by the name of Tom Mayers. Anybody ever heard of Tom Mayer? Tom is, he trained in emergency medicine, or rather trained in internal medicine and pediatrics, and but his undergraduate degree was theology, and he is the preacher of emergency medicine and the preacher of emergency medicine, patient satisfaction, and urgent care patient satisfaction. So somebody's going to answer a question and they're going to get a copy of his book. I haven't figured out which question, but somebody will get a free copy of his book. It's an easy read, and go on, if you don't have this book, go on Amazon.com, and you can get it for like 20 or 30 bucks or maybe even cheaper. But it is great for you, and it's great for your staff. It's called Leadership for Great Customer Service. Fantastic book. So, number one, always do what's right for the patient. That's why we're here. Medically, professionally, personally, always do what's right for the patient. And where we as managers and or leaders and or physician operators, directors, where we get a little bit of a bump in the road is we got to make sure that we always do what's right for the people that take care of the patients. Because if we don't do number two, we're not going to be successful with number one. And always, always, always do not confuse number one with number two. Patients first, providers and staff second. Questions, thoughts? You can jump in anytime you want. Alan Ayers, who is not here right now, but has done this type of talk many times before, talks about surface acting. Emotional state incongruent with one's inner feelings. Well, you know, I was up last night, had 14 gallons of whatever the frozen stuff is they were selling, and I lost $500,000. I'm going to sue the casino now because... So, I'm feeling bad, but that's not what I'm showing you. That's the surface act. It's incongruent. Deep acting is attempting to create the outward display that you wish to. It's a little bit more functional. And then the last one is, good gosh, I'm happy I'm here, and I really am happy I'm here. So that's the real deal or genuine acting. Really not sure why they term it acting, though. Emotional labor is the internal work and effort that creates the external display desirable to the workplace. Same thing. I'm walking around smiling, happy. Can I get you a blanket? Can I get you a pillow? You gotta do that, and it takes work. You know, if you were up all night last night with the baby, you get into work, it takes a lot more emotional labor than if you just won the lottery. Well, you probably wouldn't show up for work if you did that. But anyway, I think you guys know what I'm talking about. The game face. You got to get there. You got to smile. Doesn't matter how bad you feel. Got to dress right, put on some deodorant, and look the part and play the part. Leave your issues at home. The most important thing that we have to think about with our staff is they got to have a place to eat. I know in emergency medicine, we almost never eat unless it's a donut or a piece of pizza that the drug rep bought in. But you really got to think about your staff. If they're not eating, if they're not satiated, if they're not drinking enough, that would be non-alcoholic, then they're going to be irritable. And it's going to affect your patient satisfaction and your volume too. You should have an off-stage area. No phone calls in the treatment area. They need to eat and take a breather. Now, again, in a small urgent care center, that's tough. How many people have off-stage? And I'm not talking about just your office, management office. Off-stage areas, it's tough because you don't, oh, well, wow, that's great. Technology. Policies, cell phone use with staff. Most annoying thing when I go in a room and the patient is talking on a cell phone. Goes both ways. Internet use by staff. This is big in hospitals. Any problems with that? Do you guys put blocks on your computers? Yes? No? Hands? Yes? Blocks on computers? Facebook by patients. Awful story. So I just hired this young guy, really smart guy, and he was working a night shift, and he'd work a string of night shifts. Patient came in, or family came in with the patient. They were unhappy with his care, though his care was completely appropriate. And he did one of these. And what happened? Person took a picture of him, was on Facebook the next day. Unbelievable. Facebook by staff. Anybody have any HIPAA issues? Oh my gosh, that is a cool looking broken bone. Stories? No, my point is not you do have to have a presence on Facebook. Not my point. But taking a picture of the ugliest laceration that you took care of last week, or somebody that has angioedema, and putting it on Facebook, that's the issue I'm talking about. Putting patient information or a patient case. Oh, I took care of the coolest patient last night, and you put it on your Facebook. Oh, I see what you're saying. Yeah. That's okay. Now I understand. Makes sense. Any other stories, Facebook adventures or computer adventures? No? Is it too early? Did you guys see the presentation this morning? Come on. All right, so what do we dislike about each other? Physicians, raise your hand. Physicians. Come on, don't be bashful. Nurses, we love you. I married one, and she's the best thing that ever happened to me. Administrators, well, I don't know about. Okay, so what don't we like? The number one thing that nurses and administrators don't like about a doctor is he's too damn slow. I mean, and you know, I've had to counsel and train and educate docs that are slow. Most of the time, it is really difficult. The other thing is you guys don't have a lot of ordering from a lab standpoint and MRIs and things like that, but you got doctor order everything. Or let me see, I'm going to get an x-ray of the big toe, and then I'm going to get an x-ray of the little toe, and then I'm going to do a flu swab just because the flu's here. You know, you sort of piecemeal it. The other thing is, all right, nurses, sign of hands, the doctor does not go in to talk to the patient on discharge. If you ask him to. Do you guys ever have any problems like that? I saw it. That was a yes? Doesn't it drive you nuts? They won't? All the time? They need to be shot. All right, let's see. On the phone with their stockbroker. That doesn't happen too much. Okay, nursing. I walk in the room, and Mrs. Jones has back pain. And she's got a down jacket on, and she's got a sweatshirt on, and she's got a shirt. It's really hard for me to examine the patient. Please take the patient's clothes off and put them in a gown. Drives me nuts. Suture sets, rooms set up correctly. Again, this is all part of efficiency. I've got some departments that I walk in a room, I talk to the patient, the lidocaine's there, the suture set's open, the nylon's there, we can wham, bam. If I have to put together a suture set all by myself, number one, I got to go look for it. And number two, I got to open it. It's going to take us a lot longer. And that is going to, we got to help each other. We are a team. On the internet. Now, again, we just talked about that, so we don't need to talk about that anymore. Smile, smile, smile. Be happy. We made a choice to take care of patients. That's our job. We need to enjoy it. If we don't enjoy it, then we should look for another profession. We really should, because if we didn't have patients, it's like in the ED. The most common thing I hear is, good gosh, why is that guy here? Well, if he wasn't here, you wouldn't have a job. Now, you know, if he wants Vicodin or something like that, that's my next lecture, by the way. So, smile, be happy. We made the choice. You don't get a second chance to make a first impression. You know, if you just opened your center and you annoy that person, what's going to happen? They're not coming back, and they're going to tell everybody else how bad the service was. A-team behavior, positive, proactive, confident, team player, sense of humor. Does what it takes. Everybody gets together. Again, it's not just one person, it's the whole team. You guys know this. Negative, reactive, late. Late. Oh, God, I hate it late. My wife bugs me, and I'm really bad. I'm always 2 minutes after, which is really unprofessional, but it is a hard habit to break. Constant complainer, Dr. Jekyll, Nurse Ratchet. What do we like to see in each other? Quality care, friendly, smiling, polite, fast and flexible, easy to work with. Any questions, thoughts, comments? Anybody got a bad experience, bad hiring experience? Somebody's got to have one. Yes, sir. What was the problem? What'd you do about it? Okay. Well, there you go. All right. You know, if you hire the right people, your incidence of having problems is lower. Everybody has a bad day. Everybody has, you know, there's a good percentage of people that have depression, that have bipolar disorder. Yes? Oh, yeah, you know that CV that's, oh, my gosh. Listen, I know. You look at the CV or their resume, and you're going, "Oh my gosh, this person's unbelievable," and they're a dirtball. Yes. That's interesting. Yep. Yeah, you're right. Unfortunately, in my side of the world, you've got corporate HR issues. It's a whole lot more difficult to do that process. But you're right. That's a mileage test. Yes. Yeah. Oh, even more so. You don't have a choice. Trust me. In emergency medicine, in the places that I staff, in the middle of nowhere, you don't. A lot of times you don't have a choice, and the CEOs, and she's doing it, so it's possible. Yes, sir. We're going to let you guys talk. Explain your question again. Oh, okay. All right. So I'm sorry. Did you guys hear? Hello? No, I'm going to give it to her. Okay, if you could explain the scenario. And
so the gentleman here, the physician here, just asked me what the process was. And after I do the first interview, the desk interview, and I ask the 40 questions or whatever, I ask them the next part of it is a week-long interview where it's a paid interview that lasts a week. And I invite them to consider doing the week interview. Many times they'll say, well, I need to give my employer, a couple days notice, but I'll see what I can do. And it works. I mean, if they want the job, they come back, they work that week, and if it works out, I hire them. I would say that it's about 60% of them I hire and 40% of them I let them go. But it also determines the fit with my existing staff. Right now, I have 3 employees that I've had for 7 years.
That's great.
And then I have 3 employees that I've had for 3 years. And it's an amazing way to approach. You could just do whatever you want. I mean, I guess you can.
Within reason.
If you.
It's talking about inexperienced front-end staff doesn't work as well. He's talking about register.
Well, I don't hire inexperienced staff.
There you go.
I typically, I know this is sort of against the law, but I don't hire people in their 20s and bimbos. I just don't do it. I mean, if you can go to Blockbuster and show your belly button earring or whatever. Sorry.
That's okay.
So,
did you guys get that? So there's actually 3 different skill sets that you need, and maybe a few more. There's your front end registration staff and your techs too, that are not as skilled, and then there's your nursing staff, and then there's your physicians, nurse practitioners, and PAs. I'll get to you in just a second. His comment was it's much harder to do the 1-week trial for those registration staff type people, and I tend to agree with that. You gotta, despite the comment, you gotta watch out for your HR issues, and you gotta watch out for your labor issues, because you will get whacked. There you go. Not that you need it, but, and it's not for the comment.
I have a loud voice. Our center does similar. We do an initial interview. Javier's my office manager. I own the center. And then we narrow the pool down to our top 3 candidates, and from there we pick. And then we do a working interview as well. I feel in all the years I've been in business for 27 years, I can tell within a week's time if somebody's going to cut the grade. Whether they're a newbie, I mean, because we have an Occidental College near us that feeds us, MA X-ray techs left and right to interview, and it's a nice pool for us. Sorry. But I can tell within a matter of a week, their working interview is learning, teaching them, watching them, and you can tell if somebody's getting it. I normally can tell if somebody's getting it in the first couple of days, especially on the EMR and the software.
I'll let you hang on to the microphone for a minute. That's the great thing about this conference. It's not me, the speaker, it's us. We learn from each other. It's the networking. That's the best part about this conference. So let me go through a couple of more comments, and I'll get your question. So star qualities, looking good, dressed for success. I mean, if they come in with a Mickey Mouse t-shirt, probably don't want to hire them. Red flags, late for the interview. Negative comments, oh, those people are just always unhappy anyway. Poor eye contact. If I'm not going to make eye contact with you or you or you, I'm not going to make eye contact with the patient either. And yes, you have bronchitis. You're like a drone. So again, you got to have some eye contact. Bad-mouthing their last employer, oh my God, that other urgent care was the worst in the world. They're going to say the same thing to the next employer about you. So keep that in mind. Comments?
I just was saying that we've had success with externs just for the back office, not for front office. But a lot of these schools, these students need to carry 90 hours or 120 hours in a clinic, and so you basically have these people for a month, and you find out a lot about someone in that amount of time, and they're free on top of that for that month. And if they work well, you hire them afterwards, and if not, they're typically looking for work as well. Just a side note, if no one's doing that, it's something else to look at.
Hang on to the microphone. Okay, so the interview. That's why you got the book, because it's number 3. Consider offering a probation period. That is a great option if you can do it. You can't do it all the time. So here's my most recent faux pas, which I've made many, many, many of them. I hired a director for an ED. I mean, he had a CV 14 miles long. He looked smart. He dressed smart. And when you get that funny feeling in the back of your neck, your hair stands up. If he looks too good, it smells too good, he is too good. He lasted for 2 weeks. He irritated the entire administrative component of the hospital and every nurse. Needless to say, he was quite friendly with the nurses during that 2-week period too, and he's no longer with us. So even though they sound good, they smell good, they may not be good. Or, biggest thing I hear, competitive pay. And believe me, I've been in more than one pay competition. Okay, they raised it down the street, we got to raise it. Don't go there. You'll end up losing out if you can't avoid it. You need to make sure you have adequate staffing based on volume. Benefits. A couple of years ago we had medical scribes. We still have medical scribes, but they're outsourced. And we were paying them like $12 an hour. These are college students. And I just couldn't hire somebody and work with them and not offer them health insurance. It's just not right. So unfortunately, we outsourced it, and the new company pays them $12 an hour and doesn't offer them health insurance until they're there for a year. But anyway, to be competitive, and this is a big question, as you guys have seen in multiple lectures, benefits are a big deal. Any issues? I mean, are most of you all self-insured, not insured? Self-insured, probably not. Have some type of external benefits that you contract with somebody? What is your benefit structure? Okay, all right. How about you? That's a good idea. Gotcha. Any other benefits, comments, thoughts? Oh, crap.
We have a high deductible program for our employees, and then we allow the employees and their family to come to the clinic to meet the deductible, so they can come and receive services at our clinic. So it's a $3,000 deductible insurance, and then we invite them to come to our clinic for basic services until that deductible's met.
Any other thoughts on benefits, comments? So I'll give you my most recent benefits experience. It's kind of a sad situation. This is a young guy, 25 years old, has diabetes, smart guy, is a local paramedic, and brings us patients all the time. His company switched out to a high deductible plan. He's got an $11,000 deductible. He can't afford the insulin for his insulin pump anymore. So guess who the newly uninsured are? That's them, us. Because the deductibles are so high, you can't afford the health care. Oh yeah, you got insurance, but you don't have access because of the financial limitations. It's kind of scary. Anyway, this is not a political discussion. Moving on. Praise for performance. Somebody does a good job. I'll get to you in a second. Somebody does a good job. You need to reward them, and we'll talk about rewards in a minute. It doesn't have to be pay, but incentive pay certainly makes people happy. Yes, ma'am. We're going to try to get the microphone faster. There you go.
Hey there. Just want to say the other impact of high deductibles, we always associate that with the patient, but at the net, the employer suffers as well. If you're in urgent care and most of your patients are coming in with high deductibles, is it going to be easy for you to collect that money? No.
You are 100% correct. That's why I made the comment of the newly uninsured. In emergency medicine, we may take care of one or two people who have no resources, and we can bill them all day long. We can send them to collections all day long, but we collect $8 per patient, and that depends on where you are. That's anywhere from 10 to 30% of your patient population. Well, this new patient population, if they have a high deductible and your front-end office doesn't know about it, and you don't collect at time of service, it's going to be a problem. We could talk about that. I think we'll have a little bit of time at the end, but that's an interesting thing. What do patients expect, and how can we meet their expectations? Again, you will see me say smile all the time. Blankets, pillows, not so much in an urgent care because you really don't want them staying there that long. But the other part is you got to involve their family, especially if grandma's there. Grandma comes in with whatever she comes in with, and you explain it to her. This is my parents. Perfectly. I'll tell my dad, Mom needs to do blah, 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 and he doesn't understand any of it. So get family members involved to understand and make them feel like they're part of the situation. Make sense? Comments? Thoughts? Okay. Two types of patients. Again, you guys are dealing 99% with vertical patients. I can walk around. I can make my decision. I can go to urgent care A, urgent care B, or urgent care C. It's the way we treat them is the return business. Now, horizontal patients, on the other hand, I'm having an MI, I'm sweating like stink, I don't care who it is, just get me to the cath lab. So what do we like about patients? My wife was a critical care nurse, and she loved for me to give her an order for PRN, fentanyl, and, you know, something like Pavulon. Nice, quiet, peaceful, ventilated patient, and they don't move. So, quiet, sedated, compliant, wants only one thing. Okay, I stubbed my toe, and I have a headache. Nope, nope, you can only have one complaint per visit. You have to sign back in for that second one. Bad patient, demanding, comes in with the most recent Google search of you know, yellow fever. I've got yellow fever, I'm sure. 20 family members. Again, you kind of gotta gauge your care, and it gets tough at times. Yes. What's that? Uh-huh. Hold on.
Some of the patients come for physicals. At the same time, they have another problem. We tell them insurance doesn't pay both. Either they pay for physicals or the complaint.
Yeah, they're trying to get a 2-for-1 now.
They get mad.
I agree with that. Okay, so did everybody hear that? So what do you do? Person comes in for a physical exam, and they say, oh, by the way, I got this goop coming out of my eye or somewhere else. What do you do? Treat both conditions, or say you got to come back for it? That's a different situation. A physical exam, I think, is completely different than the sore throat and my big toe hurts.
I think it really depends. I think part of this depends upon how you structure your organization.
Yeah.
I started out as primary care. We have a primary care office that's just strictly primary care. Our urgent care is urgent care.
Yep.
It only sees urgent care. It doesn't do follow-ups. It really doesn't do physicals other than sport physicals for kids. And if they have something other than that urgent thing going on, we use the urgent care as a referral base right into the primary care,
Yep.
and we do it that way. So
Great idea.
we actually take some of these and turn them into positives because we try to spin it back into our other parts of our organization.
That's a great
versus
point.
just, and 20 family members, great. That's 20 potential customers. What the heck? I'll do it every time.
Yeah, I like that. Wish I had another book. Yeah, I mean, yeah, I don't disagree with you. You just have to have your own policy, and there is a limit. You know, patients will try to. It's tough, you know, when you don't make a lot of money and you have some medical problems. You want to get the best deal you can get. So
We tried the gentleman's approach, but they don't want to pay the second time co-payment. They want to cover the previous co-payment.
yeah, again, I don't have an answer to that.
No, it's nothing wrong. I don't mind of giving free.
Yeah, I think.
But it's a violation of the insurance policies.
I'm not so sure. I don't think an insurance carrier is going to hold you. They do? They will? Okay. Oh, no, I understand. Yeah. Separating the two process, I agree with that. But, you know, from my standpoint, okay, so I'm doing a DOT physical. Well, no, I can't do it that way. That's a bad example. I'm doing that's a really bad example. I'm doing a sports physical for an 18-year-old, and oh my gosh, he hurt his ankle or something like that. I would treat both of them because two things. One, you're going to get a patient complaint, and even if you eat $20 or whatever it is, it's the right thing to do in the long run. Again, back to the golden rules. Always do what's right for the patient, and you'll do fine.
Yeah, in my clinic, if somebody comes with a sports physical and they also want to be treated for an upper respiratory infection, they actually get two charges. They actually are scheduled for the school physical, and I get the chart for the rest of the upper respiratory infection problems. So they're satisfied. They just get charged twice. So.
Okay.
One of the problems that we have with the new era of the patient satisfaction and patients really dominating and ruling, especially with the Affordable Care Act, is pain medications. And in our environment,
Next lecture.
in Wasilla, in our environment, oh my gosh, I mean, there's pain clinics popping up every 600 yards.
Yeah, we're actually, I am going to talk about that
Okay.
in my next lecture. So you have to stay. All righty. So, the most important thing about staff challenges is you need to start it when you hire them. You need to say, this is what I expect. And if you need to, you put it in writing and you have them sign it. And you keep that. You need to communicate. Have staff boards or some way to communicate with everyone. Staff meetings are tough, but you need to, if you've got to have a discussion, people have to be involved and know what's going on. Hold staff accountable. We post, again, most of you probably don't have a commercial patient satisfaction vendor, but we have Press Ganey and there's a bunch of other ones out there, and we post the results for everybody. It's anonymous, but docs and nurses are pretty competitive. If they look at their scores and they're in the 1 percentile, and the Dr. B is in the 90th percentile, usually they'll respond. Sometimes they won't. So you got to, number one, define your expectations. Provide as much information on how your employees are performing. If they're not performing at par, educate them and redefine expectations and say, hey, you got to get better. Okay? The biggest caveat that I've learned is don't take 3 months, 6 months, 10 months. A bad employee is like cancer. They're going to infect your whole staff. Define the expectations, hold them accountable, meet with your people. If they're not getting better, terminate them. We had a lady. She was great. She was awesome, but she had the worst attitude known to man. And counseled and counseled and counseled, and she worked for the health system for 20 years. They finally terminated her. Don't take 20 years. Take 2 months, but don't take 20 years. Any thoughts on corrective action, challenges, issues? Anybody have a comment? Microphone. Yes.
Is going to be a wonderful employee. They begin working, they're great, and then over time they turn into the office gossip.
But you got to look. Okay, let me.
How do you deal with that? Because then they never do it when you're around, and you only hear complaints after the.
Well,
the
number
fact.
one, my first question would be why? Are they unhappy with their job? Are they unhappy that they're not being rewarded for the quote great care they're doing? So you got to look at yourself first. That's what I would do. Did I make a mistake in hiring the person, or is there something that we're doing that is making them unhappy? So I'll start there, and then I'll say, okay, well, I don't know whether I really hired the wrong person, but try to find out why they're acting that way. Oh, of course, yeah. That was the nurse that I was talking to you about for 20 years. She stirred, but boy, she could really stir. So, and it's just it's ridiculous. Any other thoughts, comments? All right. I think we're staying pretty close to being on time. Efficiency. You know what? Doctors, nurses, everybody can be taught to be efficient. Some people just don't get it. Order everything at one time. Plan ahead. Do your paperwork. If you're going to go into the room and you're doing your nursing notes or your physician documentation, do it real time. Go in a room and do it real time. Do the history. Write down the history review of systems, depending on what your documentation requirements are. You do the physical exam, walk out of the room and document it. That way you don't have 40,000 charts that you haven't done. Now, sometimes you can't do that. Get rid of distractions. You know, if you get 20 phone calls during a shift, you're going to be distracted. You're going to miss something more importantly. Avoid unnecessary tests, not as relevant in the urgent care setting as it is in the ED. Order everything at once. We already talked about that. You have got, this goes back to your comment about, well, this person wasn't doing so well. You got to keep your team engaged. Pull that person in the office and say, well, listen, you were awesome. What happened? You know, what happened to the Mary Jones that I knew before, that I hired? I want her back. And just be honest. Patient complaint. You guys hear that? Can you? Got to do the microphone.
You find out why they're upset and why. How do you fix it then? Because sometimes
you can't.
It's not you. It's
right.
them.
It's them.
And
yeah.
that's just who they
okay.
are. I have a stir. She doesn't get along with my nurse practitioner. She puts herself in the rooms with patients when she's a front desk clerk, so she's out of her scope. I mean, it's
2 weeks.
But I work for a hospital.
Yeah, that's okay. Okay,
I'm
first of all,
owned, and HR, it is like pulling teeth.
That's what
terminated.
I think I had before. I think you can. I think you can get rid of her. That's important. We're coming. I will tell you the most important thing, you might be stuck. HR has to be involved. You and HR meet. Well, first of all, I would meet with the person, say there's a problem, define the problem, give them time to fix it, 2 weeks, not more than that. And if that doesn't work, we're going to meet with HR the next time around. Well, that's tough. Yeah, I mean, well, that's tough. I mean, I'd like to say I've only done one termination, but boy, have I done a lot more than that. Did somebody comments? Oh, I covered it? Okay, all right. Okay. Yes, sir. I think you turned it off. You're pretty good. Okay, we're gonna get rolling. We got about 5 more minutes. Let me hold the question to the end, or the comment. Okay, keep your team engaged. You know, if you see the morale's going down, throw them a pizza party. Put a star board up. Nancy did a great job with a patient. She gets a star, and the patient comment should be on the star. People like positive recognition, and you need to recognize them. Positive comments are incredibly effective. That prize parking spot, it doesn't cost you anything. They're going to have to park somewhere. If somebody does a great job, put that as our star provider of the month. You think of stuff that isn't expensive. Pizzas, movie tickets. That's not going to cost you that much. Now, obviously, if you're a hospital system, you have to get it approved. And then holidays. This is a big one. Don't buy them fruitcake. But you know, my wife, other than being the best woman in the world, is the best shopper in the world. So this is my team. It's the blue team. My staffing, credentialing, recruiting. This is my team. And every year my wife goes to Kate Spade, or everybody know who Kate Spade is? Oh my gosh. Okay, so Kate Spade is a foo-foo pocketbook place or whatever. She goes to an outlet, and she got those usually sell for like $150. She got them for $25. Now my team doesn't know that, and please don't call them and tell them. But you know, you got to reward the team, and if you can find stuff cheap, and you know how happy they're going to be. You know, I don't have the blue team anymore. I got the pink team. But you really got to reward your staff, and it doesn't cost a whole lot if you shop smart. And it is amazing how much positiveness you'll get from that. Holidays, get a list of your team's birthday parties, or not birthday parties, birthdays, and you just send them an email saying happy birthday.
Sometimes it's not necessarily how cheap it is, but what you do. We had actually had our staff meeting this goes back to December. At the end of the year, we were starting to make goals for 2014, and the staff meeting, the staff had made a goal to break a certain number of patients in a week, starting in January 2014. Well, we actually did it in December, and so I'm taking my whole staff to Disneyland.
Awesome, that's great. I gotta roll. We'll get the questions at the end, or we could stay after. So burnout. Person is late. They're sarcastic. They're a pain in the butt. Patient complaints, staff complaints, substance abuse. Next lecture. Consider the patient is depressed, untreated depression, or bipolar disorder. What does it cost you? Obviously, you already know. Poor patient satisfaction. People don't return. Poor patient flow. You know, person's waiting in the waiting room an hour and a half because nobody discharged the patient in the back or whatever happened. It costs you money. It's a whole lot more expensive to recruit another, nurse or provider than to rehabilitate. But sometimes you got to know when to call it quits. We've already talked about most of this stuff: meals, breaks, offstage area, and open door management policy. If you got a problem, come and talk to me. Put an old person with a new person. Have a buddy system. Healthy living program. If they get out and exercise, maybe they'll be a little bit happier. When things go wrong, address it. Somebody complains, you know, patient satisfaction is patient satisfaction. The patient does rule for, 70% of the time. Now, if there was something done completely correct, or they didn't get their OxyContin, then I would think twice. But patient complaints, address them fast and address them early, and keep track of who they're complaining about. Listen, apologize, fix it, follow up. If I say Mr. Jones, I'm sorry it took us 7 hours for us to x-ray your toe, call them back in a week and say, you know what, we talked to the x-ray department, we improved our processes, and thank you for letting us know. That's the end. Speedy Gonzalez. Always do what's right for the patient, and always do what's right for those who take care of the patient. We have a great opportunity. This is a great time. I'm going to talk about depression in 15 minutes. But I appreciate you coming. Any last comments, questions, thoughts? If you guys could just pass the microphone around.
For the bad apple syndrome, there's a lot to be said for prevention. And the way that I handled the bad apple syndrome, the person that's sarcastic, I made a no gossip, no collusion policy that each employee has to sign. And as soon as it starts, I invite them into my office and I ask them what's going on and let them start talking. And I just nail it every single time. Because if you let it walk by you that 1 minute, you've authorized that behavior. You're paying that person to be like that in your office.
You pass the microphone back. Okay, so just like any good patient satisfaction survey, I'm going to get a survey, and you guys have to put I don't know whether it's a 5 or a 10, but I want 10. Give me a 20. Go ahead.
Hi. Just want to elaborate on the comment that was just made. As a manager, I practice a policy of openness, positivity at all times, regardless of the situation, and anything and high energy and enthusiasm for the environment. The reason why that's important is that, you know, when you come across a negative stuff, and you are a display for everybody else. So some of the values are absorbed by just you being there. And if they're not, then that's when you know, very politely call people and let them know ahead of time what your values are and what your expectations are.
So, gentleman behind you, that's going to be the last one. I can talk a little bit afterwards, but a couple of things. My email address, in case you're having problems with the app, I am really not female, though I look that way on the app, I guess. My email address is mboyle@eci-med.com. If you have any problems getting the presentation, or if you want the presentation, email me and I'll send it to you. And the other thing is, let me know and be honest. You know, good gosh, that was the worst damn lecture I've ever been to. You know, email me. Let me know. I want to make this better, and the only way I can make it better is get input. mboyle@eci-med.com. Gentlemen in the back.
Yeah, my comment may be just a benefit to physicians who are employer, having my experience built from 2-man group to 24-man group. A lot of the times we're just having problems with different providers coming in. So our attitude that's worked really well is we sit down and we look at providers and we look at mostly at behavior. And if we have a problem, we look at, do we want to institute palliative care or curative care? And if you want to institute palliative care, the problems of behavior will surface down the road. If you want curative care, then you just got to surgically take that person out. And sometimes palliative care helps because the patient is capable, the person is very capable and he works in your center, but sooner or later those problems
you're right,
surface.
but actually I found a new solution yesterday. It was in the exhibit hall. It's that little TENS unit, bitemporal, turn it up, a little bit of ECT therapy.
The hardest thing for us is that unfortunately the providers, they make us money. And
I agree.
they make us money and you need them and they're competent.
Yep.
But that is palliative care.
I agree. All right, I hope you guys stay for the next one. Thank you very much, and have a safe trip home.